Good afternoon, everybody. Welcome to the Disability Data Launch for the new report, Neighborhood Conditions for Adults with Disabilities in Chicago. I'm Ellen Wernicke. I am an accessible communication specialist here at the Mayor's Office for People with Disabilities. We will get started with our formal presentation in a few minutes. This program includes live ASL interpretation by our interpreters, Jennifer McElroy and Walter Matthews, as well as captions on Zoom. The interpreters should appear on your screen now, and one will be visible throughout the presentation. To turn your captions on Zoom, look at the bottom bar of your Zoom window. If you have a captions button, you can use that. If you do not see it, please look for the button labeled More and find the captions option there. If you are experiencing any difficulty accessing this meeting, please feel free to leave a comment in the chat or message me for assistance. I'm at MOPD, Ellen Wernicke. Our first speaker today is the Commissioner of the Mayor's Office for People with Disabilities, Rachel Arfa. She has overseen the launch of the MOPD Career Center and the Access Officer Program, among many others, and she brings to this role more than 15 years working as a disability and civil rights attorney. Commissioner Arfa.
Thank you, Ellen. Good afternoon, everyone. Thank you for joining today. My name is Commissioner Rachel Arfa for the City of Chicago's Mayor's Office for People with Disabilities. I'm really thrilled and honored to be here with each and every one of you and for today's report launch. I'm joined today by my partner in this work, Chicago Department of Public Health Commissioner Ige. She is a fierce leader and a champion, and I'm proud to call her a friend. Today marks this incredible launch on disability data collection and the release of the report, Neighborhood Conditions of People with Disabilities in Chicago. Our report is now live on both MOPD and CDPH's websites. One second, I want to ensure that the access is correct. I want to make sure, can you see the interview? We're doing an access check, 1 second. Okay, perfect. First, let's discuss why this report is important. We know Chicago has a rich disability community, and we wanted to know just how many people with disabilities live in Chicago. Disability must be included in data collection, and it plays a key role in ensuring the equity and inclusion. Today's report does that. Through today's report, we learn how many people with disabilities live in each of our neighborhoods and what needs are being met in each neighborhood and what opportunities there are for us. We know that 1 in 4 adults in Chicago has a disability. Because of this report, we are also able to know more specific breakdown of types of disabilities for people in Chicago. The most common is people who have cognitive disabilities, which is 12%, followed by mobility at 10.5%. People who have independent living, 8.4%. People with vision disabilities at 5%, and persons with hearing loss are at 4.3%. We also know that more than 8% of adults in Chicago have a disability that affects their ability to live independently. At MOPD, my team works to increase accessibility so that people with disabilities can live in our 77 neighborhoods. This makes the critical work that we do at MOPD through our home modification program, our career center, our independent living program, and many others. This report also shares the neighborhoods with the highest prevalence of disability. These neighborhoods are predominantly in the south and west sides of Chicago. Some additional data points: 44% of adults in the neighborhoods of Burnside and West Garfield Park have at least one disability. In West Englewood, 42% of adults have at least one disability. In Fuller Park, 41% of adults have at least one disability. And in North Lawndale and Riverdale, 40% of adults have at least one disability. As we move forward, these data points will continue to shape our work. I also wanted to give special thanks to the CDPH team, Tessa Day, an epidemiologist with CDPH. She does the unglamorous work, but the critical work behind the scenes to make this happen. And also with Claire Stanhope, who was a previous employee at MOPD and now works at Parkland College. And we're thrilled to have Claire back. And she'll share more about the work that she does here on this report, or that she did on this report. I'm really grateful to our teams at CDPH and MOPD for their hard work in making this possible. We have an incredible team effort, and most of all, I want to thank Commissioner Ige for her leadership. With that, I will turn it over to you, Commissioner.
Oh, thank you, my good friend. We not only share the title commissioner, we share passions. About 2 months ago, or maybe 3 months ago, Commissioner Arfa and I and one of our other friends, the commissioner of DFSS, we were standing together on a cold morning at Austin. And we were just reflecting how much our communities need us to synergize and collaborate and make, things more easily accessible to people. I have known Commissioner Arfa now for the last 2 years. We have been in similar spaces. We have shared similar frustrations about, the resources we need to address the things we see every day. But that day we stood there and we say, we have to do something. And now today we're here together saying, how do we move forward together? So I want to say thank you, Commissioner Arfa, for your passion to solve problems. We cannot solve problems that we don't understand. I am a public health doctor. And what that means is that I treat communities, I treat populations. Other types of doctors treat individuals. For us to treat a community, we must first understand that community. MOPD understands the community of people with disability. In public health, we talk about the social determinants of health. That is the conditions in which people live that determines if they're healthy or not. I have always been curious about what are the conditions that determine if people living with a disability are healthy or not. The health department cannot do a good job if we don't understand our communities. So when I heard that my team have been designing a process to really listen and hear from people with disability about the conditions in which they live, I was excited. I was eager to understand what are people saying about the conditions that determine if they're healthy or not. And this is what we learned. Do you know that more than a quarter of our city have a disability? I did not know that when I started in this job. That changes, knowing that number changes how I plan, for how to support Chicagoans. People living with disability are Chicagoans. They're a quarter of our population. How can I serve Chicagoans if I don't know what the Chicagoans are living with and where we need to provide additional resources? The other thing, we talked about neighborhood conditions a lot, because your health is not just about your choices, it's also about what is in your community. What we heard from our survey was that people living with disability are more often isolated. They don't feel like they are part of their community. We haven't created structures that make them feel included and part of the community. Isn't that important for us to know? If I am doing programs for communities and they are big, a quarter of the community don't feel included in those programs, how can I say I'm doing a good job? People living with a disability say they are less likely to feel safe in their neighborhoods. We are doing a lot of work to make Chicago the safest, most affordable city. But are we listening to people with disability and their feelings and their perspectives? Now we know that they feel less safe. And so we can do our work better to make sure that we are addressing the needs of those living with a disability. Now, the part that really stood out to me, because on this day that I was standing with Commissioner Arfa, we were talking about food. This report says people with disability are less likely to report that they have easy access to fresh fruits and vegetables. Now, why is that important? Do you know that most chronic diseases share the same risk factor? Access to food, high blood pressure, diabetes, cancers. All of these depend on your access to healthy food. If access to healthy food is not easy for those living with disability, how can they make healthy choices? They have to overcome more barriers to get fresh produce. That is important for me to know as a commissioner, so that when we are designing intervention, it is tailored to what people say they are struggling to access. There are many things this report makes visible. We cannot do a good job as public agencies if we're not listening, if we're not learning, if we're not documenting the realities of the people we're supposed to be serving. So I want to thank my partner, Commissioner Arfa, my team who took this on. It was not part of their mandate or their commission, but we have a lot of curious people in public health who want to understand the community, who want to explore and document and collect data to better understand how we can do public health better. And I want to thank all of our partners at MOPD who have been part of this journey with us. This has been a 3-year-long journey. Can you imagine that? And yet here we are today saying we understand our communities better. People living with disabilities are not a separate group. They are Chicagoans. We must listen. We must understand. We must incorporate their feedback and their recommendations in our planning and resource allocation. And the same way we stood together on that fall morning, we're standing together again today, telling you that we hear you and that we will use this information to better shape our programs, to better shape our resources going forward. So thank you everyone for taking the time out to come listen to what we have found. We are paying attention, we are listening, and we will be using these findings going forward. Thank you, everyone.
Thank you, Commissioner Ige. Thank you, Commissioner Arfa. I will now bring forward the authors on this report who are going to speak to us about their findings. They are, as mentioned, Tessa Day, an epidemiologist with the Chicago Department of Public Health, and Claire Stanhope, the Director of Accessibility Services at Parkland College in Champaign. Go ahead. Thank you.
Thanks, Ellen. My name is Claire Stanhope, and like Ellen said, I'm the Director of Accessibility Services at Parkland College, and formerly the training officer at the Mayor's Office for People with Disabilities. And to give you a visual description, I'm a woman with long brown hair pulled halfway up, and I'm wearing a navy sweater today. And I'm going to pass it over to the incredible Tessa Day, who's made this work possible.
Thank you, Claire. My name is Tessa Day. I'm an epidemiologist at the Chicago Department of Public Health. I'm very excited to be here today. It was wonderful working with MOPD throughout this project. And to give you a visual description, I'm a white woman with long brown hair. I have glasses on and I'm wearing a black t-shirt. And with that, I will share my screen and we can get the presentation started. And I'll pass it back to Claire.
Okay, so today we are here all to talk about the report on neighborhood conditions for adults with disabilities in Chicago. And on the next slide, so this is a new report from a collaboration between the Chicago's Mayor's Office for People with Disabilities, or MOPD, and the Chicago Department of Public Health, or CDPH. The report is available on both MOPD and CDPH's websites if you've not had a chance to check it out yet. But the goal of this was to use data to gain a deeper understanding of the disability community, specifically within Chicago. There are two key topics that are covered both within the report and will be covered in today's session. And that includes the demographics of Chicagoans with disabilities, as well as the neighborhood conditions and experiences of those Chicagoans with disabilities. The neighborhood conditions that are discussed in the report are split into 4 different categories. That includes social connection and community belonging, such as within your neighborhood or with your neighbors. The second is trust in public institutions, such as government entities. The third is neighborhood safety or perception of your safety within your environment. And fourth, your access to community resources. Tessa will dive further into these later, but these neighborhood conditions do impact the ability to live independently, access healthcare, participate in physical activity, eat healthy foods, foster social connections, and engage in other health-promoting activities. So analyzing this data allows us to understand how these neighborhood conditions may uniquely impact our Chicagoans with disabilities. The data included in this report is collected annually through the Healthy Chicago Survey. And this survey is conducted by CDPH of Chicago adults that are aged 18 and older. The survey is designed to allow the city to get representative estimates for the city of Chicago and collects data on a range of topics, including health status, access to healthcare, diet and physical activity, neighborhood conditions, and health risk behaviors. Questions regarding disability status were added to the survey for the first time in 2021, which allowed us to have enough data to analyze by this point. We know that disability can be defined in many different ways. So some of those include a self-identity of disability or a disability identity in a medical setting, legal definitions such as within legislation, and also within research and academic settings, such as how they define disability or collect data on it. And the definition that we are using for this report and for today is the Americans with Disabilities Act definition, which is a person who has a physical or mental impairment that substantially limits one or more major life activities, has a history or record of such an impairment, or is perceived by others as having such an impairment. So that's how we define disability, but the way that we collected data and identified it was using a series of the 6 questions that are listed here. Respondents were considered as having a disability if they reported yes to any of the following questions. It assessed a hearing disability, vision disability, cognitive disability, mobility disability, a self-care disability, or an independent living disability. For each of the 6 questions, respondents were considered as having a specific disability type if they responded yes to the corresponding question. These questions are the same and the same methods used by the American Community Survey, which is conducted by the U.S. Census Bureau, and in the Behavioral Risk Factor Surveillance System, which is conducted by the CDC. These questions are considered the minimum standard for collecting data on disability by the U.S. Department of Health and Human Services. So it's important to know that measuring the concept of disability can be very complex, and this definition does not necessarily align with those who would have self-reported a disabled status. Instead, it provides an estimate of the percentages of the population who, in the absence of accommodation, may have a disability. So we are going to start by exploring the demographics of Chicagoans with disabilities. This will be the prevalence of disability by age, race, sexual and gender identity, and by geography or where people live within the city. And people with disabilities do represent the only minority group that anyone can become a member of at any time, regardless of age, race, ethnicity, sexual orientation, gender identity, or income. So there is an intersectionality of identity. People with disabilities are a diverse group of individuals with various types of disabilities from every age group, race, ethnicity, sexual, and gender identity. And so everyone's personal experience will be shaped by the intersection of those unique identities, which we'll go over now. So 1 in 4 Chicagoans report having a disability. That's 25.6%, which is somewhat consistent with other data that we see across Chicago. And that's over 500,000 adults in Chicago. So disability is very common, and it's very likely that you work with or live next to or interact with people with disabilities on a very consistent basis. People with disabilities live in every neighborhood in Chicago. There is a higher prevalence of disability in some West and South Side neighborhoods. And so on the right of the slide is a map that represents where people with disabilities are concentrated in the city of Chicago. The lighter blue represents lower rates, while the darker the blue represents higher rates. There are 8 communities that have the highest prevalence of disability, and in those communities, over 40% of adults report a disability. That includes West Garfield Park, North Lawndale, Fuller Park, West Englewood, Burnside, Roseland, South Deering, and Riverdale. And that's important to note because it helps us understand where disability occurs most commonly in the city. The most common types of disability are cognitive and mobility disabilities. So cognitive disabilities are 12% and mobilities are 11%, so just slightly lower. An independent living disability is at 8%, visual disabilities at 5%, hearing at 4%, and self-care 3%. So that's the distribution of those who reported disabilities to us, and 42% of adults with disabilities report having more than one type of disability. So it's very likely that people fell into more than one category of type of disability. Just like disability occurs in every neighborhood in Chicago, it also exists in every age group. It's most prevalent among adults age 65 and older, and that's very common in data because oftentimes people do age into having disabilities. However, A quarter of adults aged 18 to 29 also report having a disability, which is a bit more surprising. So our younger adults also have a disability and report the second highest rate of disability. The types of disability that are most prevalent tend to change as people get older. So here we have the age distribution of people with different types of disabilities. And among people with cognitive disabilities, 69% are aged 18 to 44. So it's a younger population of people that tend to report cognitive disabilities. In contrast, compare that to the mobility or self-care disabilities, where about 80% of people with those disability types are over the age of 45. So type of disability can really depend on age and what is reported. Disability is more commonly reported between our Black and Latino Chicagoans at 32% and 27% respectively. The next category is Asian or Pacific Islander, which reports about 20% rate of disability, followed by white with 19% of disability. Disability is also more common among our LGBTQ plus adults compared to cisgender and heterosexual adults. So again, that gets into the intersectionality of disability and that our Chicagoans with disabilities may have many different identities. 31% of LGBTQ plus individuals report having a disability in Chicago. And now I'm going to pass this over to Tessa, who's going to discuss the neighborhood conditions.
Thank you, Claire. So I'm going to run us through the next section of the presentation, which is going to explore the neighborhood conditions and experiences of people with disabilities. So we looked at a few different domains of the neighborhood that I know Claire mentioned at the top of the presentation. But just to remind you, we looked at community belonging and connection, perceptions of safety and violence, trust in public institutions, as well as access to resources and some of the physical conditions of the neighborhood. And so we're going to start with thinking about the perceptions of belonging and connection within a neighborhood. So we have three metrics that we looked at kind of assess this data. And we first asked people if they feel like they are a part of their community, if they feel like they belong. We also asked people how many neighbors they have that they know well enough to ask for help if they needed it. And then we asked people if they feel like they have the ability to impact their community. And so before we go through the data, I'll orient you to this bar chart here because you're going to see this repeated in the next set of slides, kind of with just some different data in it. So every time we see this chart, the green bar will represent people who reported a disability. The blue bar will be people who did not report a disability. And we're comparing them on each of those metrics that I just mentioned. So when we look at this data, we see a pattern emerging across all three of these measures, in that adults with disabilities consistently reported lower levels of neighborhood belonging and connection than those without disabilities. Belonging is a really meaningful part of the neighborhood experience. It shapes how people move through their environment and how comfortable they feel engaging with their neighbors and in community activities. There can be mental health implications when people feel isolated from their community, but there can also be physical health implications. We can think about this middle metric, having neighbors that you know well enough to ask for help. That can be really critical in like an emergency situation, for example, where you may need to rely on your neighbors for help. And that may be especially so for people with disabilities. And so when we look at this data, it can prompt us to continue exploring what are the social and physical structures that are creating these gaps in neighborhood belonging and connection. And with that, we can move to our next topic, which is perceptions of violence and safety in the neighborhood. So again, we asked about three different metrics. The first being, we asked people if the fear of crime prevents them from doing things that they would otherwise like to do. We asked people how often violence occurs in their neighborhood. And we asked people if they feel safe in their neighborhood. And again, we see a pattern emerging here, and that's going to be a theme across a lot of the data that we're sharing today. But we see here that adults with disabilities reported more violence and feeling less safe in their neighborhoods than those without disabilities. And I think this top metric here, fear of crime, preventing people from doing what they'd like to do, really captures why this data is even important to look at in the first place and what the implications are. We see that over a third of people who reported a disability say that the fear of crime prevents them from doing things they want to do. So when people feel unsafe in their neighborhood or they perceive there to be a lot of violence around them, there are, one, mental health impacts that can be very real, and two, impacts for how people choose to live their lives. They may limit the activities that they're doing or not engage in things they otherwise would have. They may not go outside during certain hours of the day or engage in things like outdoor exercise or other health promoting activities with their community members. And so as we work toward building safer communities, I think, the data indicates that we should think about what are the additional considerations that we should be making for people with disabilities who may feel more vulnerable to victimization or violence. This next section here, we are looking at measures of trust. So we asked people if they trust their government to make the right decision on issues related specifically to pollution. People were also asked, just in general, to what extent they trust their local government and the extent to which they trust law enforcement. And we see this pattern emerging again. Adults with disabilities reported less trust in law enforcement and in local government than those without disabilities. Trust really shapes the relationship between two groups, and it influences how people are engaging with public systems, whether they feel supported by and represented by those institutions, and how likely they are to seek help or participate in civic processes. And so I think this prompts us to think about what is shaping this trust, what is the historical context, how can we build trust where it needs to be bolstered, and what are the unique implications for people with disabilities in Chicago. This next section, we're looking at access to community resources. So we have a few different kinds of resources here. So we asked people how easy it was for them to get fresh fruits and vegetables. We asked them if they had used a park in the last month, how easy it is to get to a transit stop from their home, and if they have reliable internet access. And across these measures, we see adults with disabilities reporting less access to important resources than those without disabilities. They were less likely to report easy access to fruits and veggies, less likely to have used a park in the last month, or to report that it's easy to get to a transit stop from their home. And I know, Dr. Ige mentioned it. One that really sticks out here is access to fruit and vegetables. There's nearly a 20 percentage point difference between those with disabilities and those without disabilities. And fresh produce is an essential health promoting tool, just as much as having access to outdoor recreation spaces or having access to a transit stop. All of these resources affect mobility, they affect your health, social connection, and just overall well-being. And access to resources for people with disabilities can be influenced by both the physical infrastructure and the availability of supportive services in their neighborhoods. And the last domain of neighborhood conditions that we looked at is exploring more of the physical or built environment. So we asked people about their environmental concerns in their neighborhood. So this would be things like air pollution, lead exposure, water quality, noise pollution, those types of concerns. We also asked people if their neighborhood is generally free from litter, is it clean? People were asked about the quality of their sidewalks. So if they were well maintained, were they paved and free of cracks and bumps? And then people were asked also to identify infrastructure service needs for their neighborhood. So this includes things like vacant lot cleanups, the installation of bike lanes or speed bumps, streetlight repairs, or bus stop repairs. And we see that adults with disabilities reported more concerns about their neighborhood environment than those without disabilities. They were more likely to have a high number of environmental concerns, less likely to report that their neighborhood was free from litter or that their sidewalks were well maintained. And the built environment plays a really major role in mobility, in health, and just overall quality of life. For people with disabilities, issues like sidewalk maintenance, environmental hazards, or just general neighborhood upkeep can have really great impacts on how easily they can navigate their surroundings and participate in community life. And so, we've looked a lot at all these different metrics of the neighborhood conditions today. We looked at belonging and safety, trust, resource access, and physical conditions, and we see that that consistent pattern emerges in how people with disabilities experience their neighborhood. And I think each of these domains we went through tells its own story about and highlights, the interconnected nature of neighborhood life and the way that these conditions are shaping people's daily experiences. And so as we come to the conclusion of the presentation, we want to recognize that what we've shared today is only part of a much broader landscape toward achieving that goal of communities that are designed in a way that facilitates easy access to resources for all Chicagoans, including those with disabilities. We've shared a lot of quantitative data today, and that can reveal patterns and gaps and opportunities, but we'll recognize that it can't replace the depth of lived experience and hearing insights directly from people who are navigating their communities every day. And the knowledge and the leadership and the efforts of the disability community have really shaped this work long before this data existed, and they'll continue to define what meaningful progress looks like going forward. So, our role today isn't to suggest that this data alone will transform neighborhoods or that we alone will carry that transformation forward. But the goal is to make this information visible as the first step. As Dr. Yuki was saying at the beginning, we need to know what the problem is to start making progress toward fixing it. And when data enters the public space, it becomes available for anyone to access: planners, policymakers, community organizers, anyone already working in this space, to use as they're considering access and design and resource allocation. So the project doesn't offer final answers, but it offers a starting point. And we're hoping that by putting the project or these findings out into the world, it can support and complement the work that's already being done by disability groups who've been leading these conversations for years. And so we just want to end with acknowledging that and honoring the inclusion and accessibility work being done by disability community and advocates to collect and use this type of information to advance the rights and well-being of people with disabilities. So with that, I'll say thank you all for attending and engaging in this work. I want to say thank you to Claire specifically from the MOPD team as a whole and from CDPH and everyone who supported this. With that, I'll pass it back to Ellen to close us out.
Thank you, everybody. Thank you, Tessa and Claire, for all your hard work on this report and for your presentation today. We are anxious to hear about everyone's feedback to the report. Hopefully you will be able to take the time to download it and read it for yourself and give us your feedback. I'm now going to put in the chat a feedback form that you can use. We will also be emailing it out to everyone who attended today's event. And we really appreciate your feedback and hope to spark more conversations about these findings going forward. All right, thank you to our presenters again. Thank you to Commissioner Ige and Commissioner Arfa as well. We hope you have a good day. Thanks, everybody.